Epilepsy in newborn, infancy and children have very different manifestations. It's difficult to pick epilepsy. There are a lot of epilepsy mimics. I am Dr. Lokesh Lingappa, Child and Adolescent Neurologist at Yashoda Hospitals, Hi-Tec City. They are very subtle, especially in newborn and infancy. So it's very essential to have a clarity on managing these children. So we need to differentiate whether it's epileptic event, non-epileptic event. Once you know it's epileptic event, the etiologies or the reasons for these epilepsy is very varied in the newborn period and the infancy. Whereas in children, it is less complex, more easier to note what are the different reasons. But still, you can get a lot of refractory epilepsy in these children, and we need to be able to see what are the medications that can help, how do we investigate these children, and if medications fail, what are the different things we need to do. If medications fail, we need to go back and see whether you have got the diagnosis right. If you have not got the diagnosis right, if it is a epilepsy or non-epileptic event, we need to differentiate, go back again. Second thing is, you will have to look at the medications, whether it's appropriate for the type of epilepsy and whether the dosages is being given right, whether they are able to take the medications appropriately. Once you have noted all these things right, then we'll have to look at whether there is underlying structural etiology, whether there is a genetic etiology for this epilepsy, and that's why they are not able to control the seizures. And once we are not able to control the seizures, what can we do? Then you go to the dietary management of the epilepsy, and if we fail the dietary management, whether we need to look at the epilepsy surgical options as well, which will involve once again resective and non-resective surgeries. So there is a very complex interaction of genetic, injuries in the perinatal period and the acquired causes. All these things lead on to epilepsy. So each child needs an individualized epilepsy management, which we will be able to provide.
If you found this video useful, like, comment and subscribe for more health updates.